Good afternoon, folks. Today's discussion this afternoon is discussing agitation, aggression, and sundowning in Alzheimer's disease. Okay. Agitation, aggression, and sundowning in Alzheimer's disease are not signs of deliberate misbehavior, but rather expressions of distress, confusion, or unmet needs. These behaviors can manifest as restlessness, pacing, sleeplessness, verbal outbursts, or even attempts to strike others. Sundowning refers specifically to the worsening of these symptoms in the late afternoon or evening, when fatigue and changes in light can amplify disorientation. Why these behaviors occur. The sundowning page emphasizes that aggression or agitation and aggression almost always have an underlying cause. These triggers can be physical, emotional, or environmental. Physical discomforts such as pain, constipation, or untreated medical conditions. Emotional stressors like depression, loneliness, or feelings of loss when familiar abilities are taken away. Environmental changes, including sudden moves, unfamiliar surroundings, or overstimulation from noise and crowds. Care demands that feel overwhelming, such as being pressured to bathe or complete difficult tasks. Medication effects or drug interactions that alter mood or cognition. Sleep disturbances that leave the person fatigued and irritable. Understanding these root causes reframes agitation as a signal rather than a problem to suppress. First steps to calm and assess. The page advises caregivers to begin with practical, compassionate measures. Rule out medical causes. Pain, infection, or medication issues should be checked promptly with a healthcare provider. Communicate calmly. Speak softly. Avoid confrontation Listen attentively and reassure the person of their safety. Create a soothing environment. Reduce clutter and noise. Surround the person with familiar photos or objects. Use natural light to orient them. Redirect them gently. Now, folks, when you have somebody with Alzheimer's or sundowning and they're acting out, you need to take them aside gently, calmly sit down with them and discuss that behavior is inappropriate, but don't never scream at somebody with Alzheimer's or dementia. So redirect them gently. Offer a snack, play calming music, suggest a favorite activity, or engage in a simple shared task like folding laundry to shift focus. These strategies are designed to de-escalate tension without medication, preventing and managing sundowning. Sundowning is a predictable pattern of late day agitation. The page highlights preventative steps. Maintain a consistent daily schedule to reduce confusion. Encourage exposure to daylight to regulate circadian rhythms. Promote physical activity earlier in the day, but avoid overlooking or exhausting routines. Limit late naps that interfere with nighttime sleep. Avoid stimulants such as caffeine and alcohol in the afternoon and evening. These measures help stabilize mood and reduce evening restlessness. Safety, medications, and when to seek help. Safety is a central concern. Remove hazards such as car keys, sharp objects, or dangerous household items. Remain distant if aggression escalates. Prioritizing caregiver safety. Medication use is reserved for cases where non-pharmacological strategies fail or behaviors pose a serious risk. Physicians must weigh benefits against risks like sedation, falls, or worsening confusion with medication as restraints. Those are your pitfalls for medication, to use them as restraints for people with dementia and Alzheimer's. You don't want to do that because they're at risk of falling if you do that for to control the Alzheimer's or dementia. Okay, emergency response. If aggression becomes dangerous, caregivers are advised to call emergency services and clearly state that the person has dementia to ensure appropriate handling. Where to get more support. The page directs caregivers to trusted nationals to trusted national resources for information, respite, and local referrals. Okay, guys. Now, here's your resources. I'm going to read those for you now. NIA ADIR Center for Evidence-Based Guidance. Alzheimer's.gov, a federal resource and publications. Alzheimer's Association and Alzheimer's Foundation of America for helplines and community programs. Family Caregiver Alliance for caregiver support. Respite Locator, services to connect families with local relief options. These organizations provide both practical tools and emotional support for families. Recognizing that caregiver well-being is essential to effective dementia care. This framework underscores that agitation, aggression, and sundowning are not random but meaningful signals. By identifying triggers, responding calmly, and building preventative routines, caregivers can reduce distress and preserve dignity for those living with Alzheimer's disease. Okay, guys, now here is your opportunity to discuss what I just did for you all. And some people can get more information by having discussions about this, or if there's somebody that's going through this that needs to discuss information, I'm also willing to help out with that. So with that being said, it's an open-ended question and answer session tonight for the show. So if anybody has any show questions for me, leave them in the chat below for me, and I will give you an answer if I see them. Okay? For now, Gator Wellness, take care, folks.